We're going to do forearm and hand stretches right now. It's great for any kind of patients that have tennis elbow, golfer's elbow, carpal tunnel, all that disorders of the hand and the forearm. Okay, so the first one that you're going to do is I want you to hold your hand like that with the elbow extension. I want you to just maintain that stretch, and we're going to hold it for about a minute, and that's all that we're going to do it. But as a patient, you may need to hold it for 2 to 5 minutes at one time to stretch this whole side. Okay, so with your elbow extension, and as you stretch, make sure that you're breathing. And when you're breathing, every time you exhale, you have to tell yourself that, okay, release, soften, let go, and then the muscle would actually let go and stretch it even more. And that's what your goal is. And this is a myofascial stretching, so you really should hold it for more than 2 minutes. 2 to 5 minutes is when the fascia will release. Okay, now we're going to, since you're, go ahead and do the opposite. Since you did that, now we need to stretch this. Great for tennis elbow. Just a gentle stretch. One other thing that I want to, as she's doing this, I want to say that people that have tennis elbow or any kind of tightness in their forearms, they will actually have like trigger points around here somewhere. And the way you should do this stretch and hold it for 2 to 5 minutes, but you can also do a trigger point release by just using a little pencil with an eraser. And what you could do is, it's 1 minute, but I'm going to show you. So if she was a patient and she wanted to do like a trigger point release here, so I would just go down and find, like right here, I find a trigger point, and then you're just going to hold it there. I'm using a pencil eraser because it's just easier than your fingers are. It's easier to manage. And then you hold it like that for about 2 to 5 minutes till that softens, and find all the trigger points around here, and just release all the trigger points here, and that will help you with a tennis elbow. Of course, if you're a tennis elbow patient, please call us. There are more things that you will have to do to actually get rid of the pain. Okay, so you did this, and now you will do the same thing on the other hand, but we are not going to do it in this video. If you need to do it on the other hand, please go ahead and do it. The next one is with the elbow flexion. So what you're going to do is you're going to keep your hands in like a praying position, and then what you are going to do is you're going to bring your arms down while your elbows go up. So you should feel a really good stretch here, and both do the same thing like what we did before and this, but it's up to you which option you prefer. I kind of like to do it both. So I do it this, and I do it this, and I also do it this. So you reach all the areas. So this is going down and this is coming up. And you maintain it for 2 to 5 minutes. We are not going to hold it for 2 to 5 minutes in this video, but at home you should be holding it for 2 to 5 minutes, okay? All right, go ahead and show the other one. So you're going to do this, and what you're going to do is you're going to go keep the wrist together, but you're going to, the direction of movement is going up and the elbows coming down, and that's what is, this is what is we're stretching, okay? So if you have any kind of hand and forearm issues, then we do that, okay? Okay, so the next few hand stretches, you're gonna need you'll have to sit, have a seat, and this is a great stretch for spreading the carpal. It's a good carpal spread, metacarpal spread, okay? So you're going to keep your hand on the elbow. You might have to bring this tool down just a little bit so you're comfortable. Okay? So the first one that you're going to do is you're going to keep your elbow over here, and then with your other hand on your inner thigh. And this inner thigh is actually pushing, you're pushing the hand backwards this way. And your other arm, your other hand, should be holding the base of your, so what she's doing is basically this. She's holding the base of the thumb and rotating it outward. So thereby you're really stretching all of these metacarpals, and this is so important to stretch for many, many people. So you're gonna do that and hold that stretch for a good 2 to 5 minutes. Okay. So a lot of people have like thumb issues, like CMC joint pain. So this, if you do this like every 2 hours, then it will actually help to get rid of that pain and distract this fascia that is in between these metacarpals. So I'm not holding it for this video for 2 to 5 minutes, but you should do that at home. Another way of doing it is you can hold, go ahead and show them this. This is Kat's favorite pose. She says it works really well. So you're gonna just put your hand against the table and use the other hand to stretch the thumb that way. So this is going this way and this is going that way. And you're going to maintain that stretch for 2 to 5 minutes. Okay, I'm not holding it again, but you need to hold it at home. So another way you can do it is you keep your hand like that, and then you're spreading this again over here. Can you record it? Mm-hmm. Okay. So this is what you're doing to increase the space between each of these metacarpals and reduce the tightness in there. We do see a lot of patients with hand issues, so this is a great stretch to do. Okay, and one more thing I'm going to add along with, so if this is a hand that you have problems with, and then another way, sit down so you can show it to them. So again, you can there might be trigger points over here. This thenar eminence usually has some kind of a trigger point. So you could use your elbow on it, find the spot that is very painful as like a trigger point, which is like a knot, and find that knot and then just press into it and hold that compression for 2 to 5 minutes, because it will actually relax it. And sometimes there is a good point here too. I've noticed that this is a good area to work on. And then wait for 2 to 5 minutes. Great stretch. And another way, I'm not holding it. Mind you, this is a video, but I'm not holding it for, this is only for training purposes. So again, I'm going to use this pencil. I've used this with many. So sometimes many of our patients would have tightness in between these metacarpals, and it's hard for our fingers to go in to release it. So what I do is I feel for the bone, and in between the bones I just kind of take this eraser and then slowly find those spots and release it. So if I find a spot here, I'm going to wait here for 2 to 5 minutes. And this works great for the foot too. So whoever has like foot pain can do this on their feet. And same thing over here. So I'm going to do that. It's a good way of releasing the trigger points in between. It also works on trigger finger too. So if you have trigger finger and you find that trigger area, you can just hold it there. And this is easier than trying to do it with your finger because your fingers are fatter than most of us. My fingers are fatter than the pencil, so this actually works better. All right, and that's it. Thank you.